Are you worried if taking hot baths is right during pregnancy? You need to travel, but you are not sure if air travel would be the right decision for you and your unborn child? Well, get all your pregnancy related questions answered through the most lovable expert, Dr. Parneet Kaur. Dr. Parneet is a consultant obstetrician and gynecologist. She is currently working in IVY Hospital Mohali and also runs her own private clinic. With her tender, loving care, Dr. Parneet is an expert in high-risk pregnancy management and adolescent gynecology. She also deals with teenage gynecological problems. Recurrent miscarriages, urogynecology and subfertility are dealt with utmost expertise and latest treatments by Dr. Parneet. So let's get to interact with Dr. Parneet for all the pregnancy related do's and don'ts. Let's meet Dr. Parneet. So hello ma'am, how are you?
I'm good. How are you, Gitika?
I am absolutely fine, ma'am, and thank you so much for accepting our invitation and being a part of this expert series by NewMumLife.com. Thank you so much, ma'am.
Thank you. That's my pleasure.
Thank you, ma'am. And before proceeding with the session, ma'am, I should definitely mention that we will be recording it and uploading it on the YouTube channel and the website that we manage. So are you fine with it, ma'am?
Yes, I'm totally comfortable.
Great. Thank you so much, ma'am. Thank you. So shall we begin with the session, ma'am?
Yes.
Right. So let's just discuss about those questions that are considered most important in pregnancy and are, I think, every pregnant lady's question and that need to be cleared up. So the first question, please tell us about, ma'am, is intercourse allowed during pregnancy?
Yes, intercourse is something which is totally normal and allowed during pregnancy. There are only very few conditions in which your doctor, your obstetrician might recommend you not to have intercourse. Otherwise, it's totally normal to have it.
Right. Thank you. And the second question is, ma'am, can hair dyes be used during the pregnancy?
Yes, hair colors are totally safe. Very few hair colors which are considered to have some toxins, but hair colors per se are absorbed very little in the body, so they're considered safe.
Right. So, ma'am, next please tell us about that. Are hot baths allowed? Because sometimes we are asked by our parents not to take hot baths.
See, your body's temperature is usually somewhere around 98 degrees. So a hot bath up to 101 degrees is fine, but a hotter bath is not advisable. And they are still, we're not sure whether jacuzzis and saunas are totally safe or not. So they should be avoided in pregnancy.
Right, ma'am. So that was
they cause dehydration actually. So that is what happens if it's a very hot bath we are in. Yes.
All right, ma'am. Great. And ma'am, is air travel allowed?
Air traveling is totally safe. Air travel is safe up to 34 to 36 weeks of pregnancy.
Right.
The only precaution you should take is that you should keep yourself properly hydrated while traveling by air. You should wear DVT socks. There's a condition known as DVT. So DVT socks or stockings are very important while traveling by air or by road for more than 2 hours.
Yes,
once somebody is pregnant.
Right.
And otherwise, air travel is totally safe.
Right, ma'am. And ma'am, should flu shot be taken during pregnancy? Is it a mandatory kind of vaccine?
Flu shot is basically an influenza shot. It is WHO recommended. Not only does it protect the mom-to-be from influenza, from the strain of influenza, but it's protective for the child as well till the child gets its shot.
Right, ma'am. And ma'am, what about dental care? Should one visit a dentist, especially during the pregnancy time?
See, dental hygiene is a very important aspect of a healthy life. So I suggest that I recommend everyone should visit a dentist once a year at least for the regular checkup. And if somebody is pregnant, definitely each trimester, first trimester, second trimester, and third trimester, they should have an appointment with their dentist for a check.
Right, ma'am. Right. Thank you so much for this information. It is really going to help many women. Right, ma'am. So the next question is that is it safe to pet cats?
It is totally safe to pet cats. it is a myth that cats cause diseases. However, cat feces, cat poop, that has this parasite, which is toxoplasma. So toxoplasmosis is a condition which we do not want pregnant ladies to get infected with. So definitely one should stay away from cat poop, cat litter. Otherwise, it's totally safe to pet cats.
Okay, great. And ma'am, what about exercise? Can one exercise during the pregnancy?
Exercise is important and it is recommended in pregnancy. Right. It is recommended not only for a safe vaginal birth, but for the well-being of the woman as well.
All right, ma'am. Great. And ma'am, which supplements should be taken during the pregnancy and are essential?
Supplements are very much required in pregnancy. In fact, they're required even before somebody gets pregnant. Folic acid should be taken for about 3 months before somebody starts planning the conception.
Right, ma'am.
And once they conceive, for the first 3 months, folic acid is very essential. Then later on in pregnancy, iron and calcium are required. Calcium is must, and iron depends on one's hemoglobin levels. Vitamin D and vitamin C also play a very important role in pregnancy.
Right, ma'am. Right. Ma'am, how much sleep should be taken during pregnancy?
Sleep is very much essential. It is minimum of 2 hours in the afternoon and 8 hours at night is required. In case somebody is working, then definitely they require some rest in the afternoon if they're not able to take a nap.
Right. And ma'am, any tips from you to minimize the stress levels?
Lots of fluids, stay positive, eat healthy, do not binge eat, do not think that you're pregnant and you have a free pass to eat anything and everything.
Right, ma'am.
So a healthy mind stays in a healthy body or vice versa. So yes.
Right, ma'am. Right. You're absolutely right. And ma'am, when one should visit a doctor?
So as soon as one gets to know that she's pregnant, the first antenatal visit, the first pregnancy visit to a doctor is the most important visit. There are so many queries the pregnant girl has and so many questions we have for her, which would later on result in how her pregnancy is going on. So the first visit, as soon as she gets to know, she should visit her gynecologist.
Right, ma'am. Right. And ma'am, can you please tell us about the foods which are considered risky during pregnancy and should not be consumed?
See, it's not a long list. Ideally, one should eat about everything. Whatever they've been eating earlier should be taken. But there are few foods that we recommend not to have in pregnancy. Anything which is raw meats we always avoid in pregnancy. So something which should be properly cooked has to be had in pregnancy. If we talk about milk, then milk should be pasteurized. It should be properly boiled and then cooled down probably, and then had more cold milk, whatever way. Fishes. So fishes are safe otherwise, but fishes which are high in mercury content, should be avoided in pregnancy. Blue cheese should be avoided, and raw eggs should be avoided in pregnancy.
Right, ma'am. Right. And ma'am, are applying skincare products and hair care products considered fine during the pregnancy? Should one go?
Yes, applying skincare products, hair care, they're totally safe. In fact, waxing is also considered totally safe in pregnancy. So,
right, ma'am. And ma'am, what type of meal schedule should be followed during this time?
One should have small and frequent meals. So instead of having 3 heavy meals, let us stick to 5 small meals and frequent meals. So there's breakfast, lunch, dinner, and in between there should be 2 snacks as well.
Right, ma'am. And ma'am, how much water should be consumed per day?
Water or fluids, a minimum of 2 to 3 liters per day should be.
Yes, right, ma'am. And ma'am, should long distance travel be done?
As long as somebody is traveling comfortably and going to a place where immediate medical help is available, it's not over. Yes.
Right. I think thank you so much, ma'am. You have covered up all the questions so beautifully well, and these are the questions that every pregnant lady faces. So, such short, crisp, and to the point answers that will actually help every woman who will be listening to this session. So, thank you so much, ma'am, for connecting with us, giving us your time, and taking up this session. Thank you. Thanks a lot.
Thank you so much. Thank you for having me.
Thank you so much, ma'am.